Should the healthcare system in the UK be privatised?
That is a very interesting question. I want to start my answer by defining privatization. So privatization can either be complete, where or in a country that all the healthcare systems are provided by companies or private sectors, whereas privatization can also be healthcare that is outsourced from a public healthcare system to private sectors, but still paid for by the government. So that's something we are practicing in the NHS, and by doing that, it diverts the pressure of the NHS to private sectors, and sometimes we might want to borrow the expertise of private sectors as well, which can help with the pressure on the NHS and greatly and help the patient at the core, because now they will be waiting a shorter time than compared to if all has to be going to the NHS hospitals, while still maintaining the core NHS values, as in free at the point of treatment, because at the end of the day, the private sector is firstly paid for by the government, and then we worry about it afterwards. Complete privatization, though, is practiced in certain countries, but not in the UK. It doesn't align with the core NHS values, as we discussed. But that does not mean it cannot be a good system. So we're seeing that in some part of the US, at least, they have the local governments has excellent insurance policies to cover the cost of private sector. So although the private sectors are still charging patients directly, that part of cost is alleviated by the insurance policy. It can work just as fine as the NHS if that is funded by taxes. But it has its advantages and disadvantages, and complete privatization gives a lot of freedom to private companies at the cost of people's health. Some might benefit more than others, which can create a discrimination of poverty versus rich people. But I will not say if one is better than the other. All have their advantages and disadvantages. The public healthcare system means that equal access to everybody, but at the same time, it can also mean a long waiting list, as we've seen that the backlog has been building up since the COVID, even before COVID, but since COVID has started.
Great, thank you. So, what has put the most strain on the NHS?
So the NHS is facing pressure from a lot of different sectors. A very long winding problem has been staffing, where we have a huge shortage of nurses. I think it's 44,000 nurses that we need compared to what we have, and a lot of that problem is solved by recruiting nurses from different countries, but that cannot be a permanent solution, and we are seeing the consequences of these shortages in the backlogs that's ever increasing, especially after COVID. And that is another area that puts a lot of pressure on the NHS, which is a severe outbreak of a pandemic that disrupts the normal procedures and organization in the NHS. That leads to other problems being put aside to focus on a certain type of problem, namely the pandemic. And that leads to the problems put aside become more and more severe. If a patient is, say a patient with a hip problem is left out of has his procedure cancelled, that hip problem is not going to solve itself. It's going to affect mobility even more, and potentially carry the consequence of more mobility issues like another arthritis, because the other joint is used more compared to before. That's going to contribute a lot to the backlog and put a lot of pressure on the NHS. Another part that might put pressure on the NHS is the aging population, which is a problem we're continuously having, because partly because of ever improving medical healthcare, but at the same time, aging is related to increased risk of many diseases. That overall contributes to more attention needed by the NHS, and consequently a longer waiting list, a lot of resources being used, a lot fewer freely disposable resources, and a lot of strain on the NHS.
Great, thank you. So, what is the impact of telecommunications on the NHS? What are the pros and the cons?
Can I just clarify that telecommunication means all sorts of technology used to contact patients remotely?
Correct, yeah.
Okay. So that has been a really great advance in recent years, especially after the pandemic has come in. We have seen a rise in those virtual communications with the patient, and that helps reaching the patient a lot at the time they need. And that has been retained even after the most dangerous time was the pandemic has passed. For instance, a lot of GP consultations now has moved online, and that has its advantages and disadvantages. Obvious advantages include you don't have to travel to the GP, and especially for people with mobility issues, that can be a great option compared to outpatient, which can lead to a long waiting time among other inconveniences like not having a full team supporting you. But at the same time, it comes with the convenience comes with consequences of not being able to examine fully. You have to rely on the words of patients, and video consultation may not, or telephone consultations may not be something that patients are very used to, especially in the elder community. That might not be a situation that they're comfortable in. It is very difficult to establish rapport over a camera compared to in-person interactions, and that might have an effect on the trust that the patients can develop with the doctor, which is the essence of what we build our healthcare on. So overall, it has its benefits, but it also has its disadvantages.
Great, thank you. So, what are the arguments for and against non-essential surgery being available under the NHS?
Non-essential surgery, I think, refers to those that are not immediately life-threatening or even improve the quality of life, but you can have the option to carry out, right? So an example, I suppose, can be cosmetic surgeries, where it is definitely not going to have an impact on the health condition you are in, but it's definitely going to have a very important social and psychological effect on the patient. After, say, a severe burn, a reconstruction can be very helpful in terms of the patient's day-to-day interactions with other people and building the confidence of the patient. And I think that extends to the major benefit of funding those non-essential procedures, is that it alleviates the risk of other healthcare problems that might arise from either psychologically or something you haven't, we are not seeing at the time of giving the non-essential procedure. For instance, with that cosmetic surgery example I just given, the patient, if they have to live with a barely recognizable face, that is going to have a way greater psychological trauma than if their face is reconstructed. Although that is not going to be perfect, the consequences are very different, and we might spend more money on treating the trauma compared to the facial reconstruction. And just generally, the goal of healthcare ultimately, I think, is to improve the quality of life as well as the length of life. And non-essential surgeries may not give you huge benefits as those that are threatening your life, for instance, a stent in coronary artery diseases, but they are definitely improving the patient's quality of life by removing, let's just say, some painful varicose that does not threaten your life immediately, but brings a lot of pain and mobility issues in your life. So overall, I think it aligns with the NHS core value, as in the value of healthcare systems to improve your quality of life and the length of your life.
Great, thank you. About 1 in 4 deaths in the UK is due to some form of cancer, yet in the Philippines, the figure is around 1 in 10. What factors might underline this difference in cancer rates?
There's a vast difference between the UK and the Philippines in terms of both healthcare systems and also just general culture, habits, traditions, etc. that might, of course, and demography in terms of the genetics of the population. I do not know for a fact if there's more carcinogenic, oncogens in the general genome of Caucasian population, but if that is the case, that might contribute to a higher risk for cancer. And certain populations are indeed predisposed to certain types of diseases, and that's why we do the healthcare system tend to do demographic screening before to evaluate risks of different diseases, and cancer is one of them. But at the same time, the environment can contribute just as much as genetics to a lot of diseases, including cancer. How much of the population smokes, how much of the population drinks, what the emphasis of healthy food is in the culture can all affect the patient's general health and risk to cancer. We know for a fact that smoking contributes a lot to cancer as well as alcohol. Thirdly, I think the screening program is more stringent in the UK rather compared to Philippines, and with more screening comes with more disease or cases being spotted, and I think that is also a contribution factor because more cases in the UK is picked up. We have a higher statistics, but that might not mean we are a more unhealthy population. It might just mean that we're doing more screening and more Philippines problem is hidden, and that might contribute to the statistics we've seen here as well.
Good, so thinking about false negatives, and that could be from screening. What else could it be from? If someone begins to have symptoms. If someone begins to have symptoms, how could that link? Think about education.
Oh, of course. So the healthcare campaign or the public's general knowledge about their healthcare may give rise to different attention to their own healthcare health conditions. If I have let's say if I have abnormal pain today, I might be more willing to check it out and go to my GP to find out about it, and that might alleviate a lot of problems. Whereas in less developed countries, maybe the health awareness is not as high, and that sign we may just shrug at the sign and not care about it until it develops into a more serious condition, and that might explain the difference in statistics as well.
Excellent, thank you. How does politics influence healthcare provision, and is this inevitable?
So a lot of ways can politics influence healthcare, directly or indirectly. Directly being that government's policies can have a direct impact on funding to healthcare system, which part is more heavily funded, which part is put less attention to, and that can directly impact the quality of care or what the resources we have at disposal. That is going to directly impact the healthcare. But also indirectly, the politician or the party's ideas that's presented to the media can also influence people's opinion on healthcare, how healthcare is carried out, whether healthcare is trustworthy, or what type of things we are focusing on. Because of the influence politicians has on the general public, they are going to get more coverage. Their words will be more heavily marked by the public, and that can greatly influence the public perception on healthcare and public awareness of their own health, and that can bring a very great influence on healthcare. Whether it is inevitable, I think if we are to promote equality for healthcare, we cannot avoid government funding or at least government decisions on healthcare, and there will always be some sort of influence asserted by the government. However, it doesn't have to come from personal belief from individual politicians. At the very least, we can have monitoring programs by complete separate third-party organizations, non-profits, organizations so that they can look at the funding and say, what can we improve? But also, we can just allocate that funding process to just completely to the party organizations, as we do here in the UK with King's Fund, who funds researchers and healthcare systems in the UK for the NHS. At the end of the day, healthcare should be managed by the government if we are to promote equality and public awareness, because they have the influence and might as well use it in a good way. But how great the influence is can be monitored and changed.
And how do you think certain scandals, whether it be Partygate or the Matt Hancock scandal, could have affected things?
Yes, so that will impact public trust in the government as well as healthcare system in general, especially with although Matt Hancock did not do anything directly related to healthcare system in his scandal. I think inevitably people will link his scandals with his position.
Absolutely.
And that as the healthcare secretary, that is going to be a very bad look on our healthcare system. I suppose, unfortunately, when these things happen, the influence is going to backfire at the healthcare system. But overall, if government influence can be put to the right use, I think there's more to be gained than to be lost.
Interesting. Leave it there. Thank you for your time.
Thank you very much.